Good morning to our viewing and listening public, and a very warm welcome to another Ministry of Health update on the national COVID 19 response. It is certainly a pleasure to be here with you once again. I am pleased to present today's panel of presenters. Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, Mr. Davlin Thomas, CEO, North Central Regional Health Authority, and Mr. Abdul Hamid, General Manager, Primary Care for the North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. Dr. Parasram will begin with the latest clinical and vaccination updates.
Hi, good morning. Thank you, Al. Good morning to Mr. Thomas and good morning to Dr. Hamid. Morning to the media and members of the viewing and listening public. So if you begin with my first slide, which gives the clinical update for September 7, 2021. Total tests done at both private and public facilities now stand at 321,287. Those new positives over the 24 hours are 189, taking our total since March 12, 2020 to present 46,013. Those who would have recovered 40,980. Active cases now stand at 3,691, which is significantly less than it would have been at the peak of the epidemic during this year, where it would have just crossed 10,000 active cases. So we now stand at 3,691. Of those in home isolation, 3,137. Those in hospital are 288, with 77 persons in step-down facilities at this time. In quarantine, we have 134, and deaths now stand at 1,342, and again, condolences to the families of all of those who would have lost loved ones during this time. In terms of our vaccine update, we look at total persons vaccinated with first dose of a 2-dose regime. Now standing, and this is an updated figure, not the figure on the slide, as of 8 p.m. last night, we have 532,484. Total persons vaccinated with second dose, 413,797. Those with a single dose regime, 6,863. And giving us a total of completed vaccination, both single and double dose, at 420,686, which is approximately 30% of the population. Those receiving a first dose, about 38% of the population. If we can go into my second slide, please. Yeah, so this is again giving an update as to where we stand with the active cases in the various counties. So a few weeks ago, we would have noted a proportion of the cases were really in Victoria, County Caroni, County St. George East, and Tobago. What we're seeing today is a little bit different. We saw some reduction in County Caroni, and we saw some holding and reduction in St. George East in the number of cases. We're still seeing a high caseload in Victoria, being the highest, standing at 28.0%, and we're still seeing a high level in Tobago, 12.9%. In the early part of the epidemic, we would have seen Tobago being on par with Nariva-Mayaro, which is now standing at 1.4%. That has changed significantly, with Tobago having a quite high proportion of the cases. So Tobago 12.9, Victoria 28, St. Andrew, St. David at 6, Nariva-Mayaro 1.4, Caroni 15.6, St. George East 8.6, St. George Central at 10, and St. George West 5.9. Next slide, please. So again, home isolation patients, the clinical disposition, recoveries at 4.7%, transferred to facility 4.1%, and the largest portion, 50%, are asymptomatic at this time. Symptomatic cases, 41.1%. Next slide. So we break down comorbidities again, and we're seeing again that diabetes and hypertension seems to be the largest proportion of the comorbidities found in this particular group. Heart disease 3.2%, pulmonary issues 0.6%, asthma 14.9%, immunodeficiency 0.4%, and other at 14.3%. Pregnancy, as we always say, is not a comorbidity, but it is prone to increased risk of side effects or complications of the virus, 2.6%. Next slide. Percentage comorbidities for home isolated patients, again more or less half and half, 48.4% with comorbidities, 51.6% without. Next slide. You go forward one, please. So the last slide should be giving us, go forward. We go to the slide that should be giving our age distribution, right? So this slide starting on the left hand side, and we see a very low proportion of persons at this time being infected between 0 and 19 years of age, which is very good. 25.48% between the 20 and 39 age group, and 30.2% between the 40 and the 59 age group. Those above 60, 20.02% between 60 and 79, and above 80 still having a significantly high proportion, 17.22%. I believe that is the last slide. Oh, so there's one other slide with the male-female distribution, and we have seen this fluctuate throughout the epidemic. More or less it has been half and half. We're seeing a slight male predominance, 54.7%, female predominance, 54.7%, versus males, 45.3%. And I believe that's the last slide and the end of the clinical update for this morning.
Thank you very much, CMO. Now, I have heard, I'm sure you have heard as well, several persons explaining that they have not taken the vaccine because of reasons such as they have high blood pressure, diabetes, asthma, high cholesterol. Dr. Hamid is here to answer this question and address other concerns about the risk relating to persons with NCDs taking the vaccine. Good morning, Dr. Hamid.
Okay, good morning. Dr. Roshan Parasram, CMO, Mr. Davlin Thomas, CEO of North Central Regional Health Authority, and Mr. Alexander, Corpcom, Ministry of Health, members of the viewing public and listening public. Good morning, everyone. So my task here today really is to educate the public for in terms of questions that a lot of persons have been asking. I have diabetes, I have hypertension, I have obesity. Should I take the vaccine or not? So what I'm going to do here today is give a brief presentation concerning these comorbidities and highlight the risk that COVID-19 places to these persons, as well as to encourage persons to get vaccinated for these comorbidities. All right? So COVID-19 and chronic diseases. So first slide, how does COVID-19 impact on the following? Diabetes, sugar, obesity, hypertension, heart disease, asthma, and cancer. These are what you call the most common NCDs or chronic diseases that we have in Trinidad and Tobago. And they are also extremely high risk for death and disability after a COVID-19 infection. Next slide. So COVID-19 and diabetes mellitus. So the care of patients with endocrine disorders, including diabetes, during the coronavirus disease pandemic poses unique challenges. And the patients with diabetes are at risk for more severe illness. It appears to precipitate severe manifestations of diabetes, such as diabetic ketoacidosis. Next slide. So the risk of severe COVID-19 in diabetics, the evidence. Patients with type 2 diabetes are more likely to have quite serious complications, more ICU admissions, longer length of stay, and death from COVID-19. In a study from United States, the mortality rate was 14.8% and 28.8% in patients without diabetes or uncontrolled hyperglycemia, compared to 6.2% without either. Poorly controlled diabetes is a risk factor for infection in general. An elevated BMI, body mass index, was also associated with increased COVID-19 mortality. And for a fact, Trinidad and Tobago has a very high prevalence of persons with elevated body mass index. Next slide, please. So obesity, an important risk factor. A study of 2,500 patients in New York City revealed that obesity was associated with an increased risk of intubation or death among adults less than 65 years of age. An analysis shows that obese individuals had 46% higher risk of being COVID-19 positive and 113% risk higher of being hospitalized, 74% higher risk in the need of ICU care, and 48% increased risk of death. Next slide, please. And very important, COVID-19 and hypertension. And hypertension in Trinidad and Tobago, we have an estimated prevalence of 30% of the population and 30% of the adult population, which postulates approximately 300,000 persons. Growing data shows a higher risk of COVID-19 infections and complications in people with high blood pressure, and we saw this from the outset of COVID-19 infections worldwide. Analysis of data in China and the USA shows that a high blood pressure is most commonly shared pre-existing condition amongst those hospitalized, affecting between 30 and 50% of patients. And a report from Italy revealed that 76% of patients who died from COVID-19 had hypertension. Next slide, please. And this is a question that we have been asked a lot, COVID-19 and heart disease. COVID-19 can damage your heart directly, especially if your heart is already weakened by the effects of high blood pressure. Past studies had shown that people with heart disease who get a respiratory illness like flu or earlier types of coronavirus are at a higher risk of heart attack. And COVID-19 may also cause inflammation of the heart muscle, a condition called myocarditis, which makes it harder for the heart to pump blood. Next. So how do I protect myself if I have pressure or heart disease? Number 1, get vaccinated. Practice the 3 W's. Take all my medications as prescribed by my physician. Decrease salt in my diet. Lose weight if overweight. Get active. Exercise. Quit smoking. Avoid or limit alcohol. And eat healthy. Next slide, please. And the next chronic disease, COVID-19 and asthma. So people with moderate to severe uncontrolled asthma are more likely to be hospitalized from COVID-19. Also, with those with coexistent COPD, chronic obstructive pulmonary disease, and non-allergic asthma compared to allergic asthma are at increased risk of worse outcomes. So to reduce your risk, continue avoiding triggers, taking a prescribed controller, reliever therapies such as corticosteroids, Bucotide, and Ventolin, and make sure and get vaccinated. COVID-19 and cancer. Next slide. Most data suggests a high incidence of COVID-19 in cancer patients relative to the general population. The CDC considered that cancer represents an established or probable risk factor for severe COVID-19. Cancer patients with fever or lower respiratory symptoms, such as cough, are prioritized for COVID-19 testing. Notwithstanding possible decreased immunogenicity, all individuals with active or prior cancer who are eligible for vaccination should be vaccinated against COVID-19. And the final slide. And this is the take-home message for the general public, Trinidad and Tobago. Chronic diseases increase the risk of severe COVID-19 and death. Primary prevention in the form of vaccination is the mainstay of mitigating the risk associated with COVID-19 in patients with diabetes. In TNT, people with chronic diseases have been prioritized for receiving the COVID-19 vaccines. And vaccines available locally have been shown to be safe and effective and protect people against COVID-19. We encourage everyone with these conditions to get vaccinated as soon as they are able. Get vaccinated today. Thank you.
Thank you very much, Dr. Hamid. Well, folks, you heard it directly from Dr. Hamid. Please, if it is that you live with NCDs, get vaccinated. You have a wide range of vaccines to choose from. I now invite Mr. Davlin Thomas to update the public on the work being done at the NCRHA regarding vaccinations and the operations of both the traditional and parallel healthcare systems within his region. Mr. Thomas, good morning.
Yeah, good morning. Thank you, Mr. Al Alexander, the Senior Corporate Communications Practitioner at the Ministry of Health, Dr. Roshan Parasram, the Chief Medical Officer, Dr. Abdul Hamid, who's the General Manager of Primary Care at the North Central Regional Health Authority, the staff of TTT, members of the media, viewing public, good morning. Vaccinations are provided at the following sites, just as a reminder, within the NCRHA. The Arima Health Facility, Blanchisseuse Health Center, the La Hoqueta Health Center, Maloney Health Center, San Rafael Health Center, Talparo Health Center, Chaguanas District Health Facility, the Cunupia Health Center, St. Helena Health Center, Aruca Health Center, Macoya Health Center, the St. Joseph Enhanced Health Center, Tacarigua Health Center, and at the mass vaccination sites, which include the UTT compound on Monroe Road, the Wallerfield Raceway drive-through, the Larry Gomes Stadium, the Costat El Dorado campus, Trinity Mall on Fridays and Saturdays, and the Center Point Mall on Fridays and Saturdays. Some of the highlights, though, of our vaccinations include some of our outreach in collaboration with a number of businesses and organizations and associations. Some highlights are Fernandez Compound, the Foundation for the Enhancement and Enrichment of Life, Pennywise employees, the Chamber of Commerce in our various areas, the health centers, the healthcare and frontline workers in private facilities, the churches, temples, and mosques within our vicinity, the members of the Chaguanas Lions Club in particular, the funeral homes in particular, the Montrose Business Association, Food and Beverage Sector, and the Airport Authority of Trinidad and Tobago. We mentioned them to again invite companies, etc., to feel free to contact the NCRHA at 662-5579. That's companies for 662-5579 for your groups or your colleagues within companies and associations and organizations. We'll save you the trouble. Get vaccinated. We will come to do the group of you. The total vaccination doses that the NCRHA have administered to date are 181,845. That's 181,845, which includes the elderly Express experience, which is the highly personalized premium VIP experience for elderly, which visits homes and caregivers. We've vaccinated at a rate of 1,249 elderly persons at those homes. The NCRHA staff in particular must be lauded as they continue to display courage and valor and honor in the face of this COVID-19 monster. They stood their ground at pillars and posts, raceways, malls, community centers, homes and health centers with the vaccines in hand to besiege and beset it. And with the help of God, we will defeat it. You need to get vaccinated. If not for you, for your children, for your auntie, for your uncle, your mommy, your daddy, they need you around. So if not for you, get vaccinated for them. Why chance it? They need you around. Do it for them. Get vaccinated for your loved ones. A word to the wise is sufficient. Our preparations as an RHA for the at the NCRHA for the worst case scenarios included our purchase of a number of pulse oximeters and which include possibly about 1,279 of them, which we issue basically to our at-risk COVID-19 quarantine patients. We've purchased at least 249 additional cardiac monitors, 126 of which are in use currently across the NCRHA. We've also purchased, so we have some surplus capacity for a worst case scenario. We also have purchased additional high flow nasal cannulas, which has proven to be very effective. We have at least 40 additional ones in use throughout the NCRHA within this scenario. The other issue is that the NCRHA has as well recently launched on Google Play Store our Preview Checkup app, which is a preview checkup app. This commingles the use of the SpO2 monitor. You download the app. Once you are one of our patients who have been sent on quarantine, you monitor your SpO2, you enter your SpO2 readings into the app, and the app then would signal to us if you require any assistance. We have currently 115 persons currently actively using the NCRHA Preview Checkup app. 115 persons currently, and we basically most recently would have escalated at least one patient to receive GMRTT pickup based on the app. It's being monitored. Those persons are being called directly by doctors once the app alerts us. An average of 18 persons utilize the app for checkups during the day, at an average of 3.7 times per day. So it means that people are actively engaging the app for their checkup. So for our NCRHA patients who basically are on quarantine, we urge you to utilize the app, commingling that app use with the SpO2 monitors that are issued to you via the emergency department. Enter your data into the app, and it's very simple and easy. It's on Google Play. It's Preview Checkup, NCRHA Preview Checkup. In addition to that, our telemarketing efforts led by Dr. Hamid continue to engage over 30,000 patients with diabetes, hypertension, and heart disease, particularly to engage as a barrier to deter a possible future influx of NCD patients into the hospital system. The prescription drugs are issued to a health center near you. Thank you.
Quite welcome, CEO. And of course, I just want to re-emphasize, if you are a member or leader of a group, a company, organization, or association, and you want to get your staff vaccinated, it can be done at the NCRHA. The number again, 662-5579.
And just to emphasize again, thanks Al for reiterating, but that we will come to your association group, etc. We'll save you the trouble. We will come to you.
Thank you very much, CEO. We now move to one of my favorite segments. That is the You Speak. On You Speak, we traverse the country to speak with you, to hear your concerns, and have members of the panel answer your questions. So without further ado, let's find out which part of the country our questions will come from today and what these questions will be.
Hi, Hi, I'm Natasha Lake from Next 99.1 FM. Last week we were in Chaguanas, and this week we are in Princess Town to hear your questions and concerns about the COVID-19 vaccine.
For people who have high blood pressure, do you think it is okay for them to take the vaccine, or what type do you all recommend?
Yeah, we'll ask Dr. Hamid to answer that first question. Hi, Dr. Hamid.
Hi, good morning. So, yes, it is recommended if you have high blood pressure or hypertension or pressure to have the COVID-19 vaccine. Every single vaccine is recommended. The sites are available everywhere in more than 109 sites and health centers, plus the mass vaccination site at a walk-in basis.
Why, if we're taking the vaccination, we still have to wear masks? And what is the real purpose of the vaccine? Because with the vaccine, you could still get the COVID, and without the vaccine, you could still get the COVID.
So yes, so there's some truth to what is being said. So generally speaking, when you take a vaccine, what you do, the most important thing about vaccines is that they prevent you from getting severe forms of the disease, and of course decrease the likelihood of you dying from COVID-19. There is a chance that you can become infected still, and for that reason we are asking everyone to wear your mask. If you have two persons a short distance apart and they're both wearing their mask, your chance of transmitting is less than 10% from one individual to the next. It forms part and parcel of the armory that we have. It's difficult even in a setting when you go out into the public spaces to tell who is vaccinated and who is not. For that reason, for now, masks are mandatory in public spaces. It has to cover your nose, mouth and chin at all times. It is a very effective public health tool for decreasing the risk of transmission of this respiratory disease as we build our vaccination rates in the country towards higher levels. Thank you, Al.
Yeah, thank you.
The question I have about this vaccine is, I would like as a citizen to get the Pfizer vaccine.
So you asked and we delivered.
Well, given the invisible monster that is COVID-19, my advice is that you get whatever vaccine that is available to you that is approved by WHO. But to answer the question directly, Pfizer vaccines could be acquired in the north at Hazley Crawford Stadium drive-through, the Napa, the Paddock, Queen's Park, Savannah, in central Atobolan Stadium, the UTT campus, Chaguanas, in the east, Costard campus at El Dorado, Frankie Boudram, Wallerfield International Raceway, the Larry Gomes Stadium, Duranta Gardens Community Center, National Racket Center, Tacarigua, the San Grande Civic Center, the multipurpose complex in Rio Claro, which is the Sumer Singh multipurpose complex in Rio Claro, the Mayaro Civic Center in the south, Cedros Health Center, Debe Health Center, National Energy Skills Center campus in Labrie, the Penal Powergen site, Southwest Regional Indoor Facility, Point Fortin, the Southern Academy for the Performing Arts and in Tobago, the Canaan Health Center, the Lekoto Health Center, Mason Hall Community Center, the Roxborough Health Center, the Scarborough Health Center, and the Magdalena Grand Beach and Golf Resort. And you can also get any of the other vaccines at that site. And as I want to reiterate again, get whatever vaccine is available and approved by the WHO.
Thank you very much. See you. Well, folks, that is all the time we have for this episode of You Speak. We thank the public for posing these very important questions and the panel for providing these responses. I invite you to address your COVID-19 questions to us and look out for the You Speak team in your area. You may very well see the You Speak team in your area next. As we go to the question and answer segment, we once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Ask your questions one right after the other to the relevant members of the panel. We will accommodate a second round once time permits. Today we begin with AZP News.
Good morning, Prior Bihari, azpnews.com. My 2 questions today for the CMO. CMO, I wanted to speak about the 6 Delta cases that we have. 2 of those were from fully vaccinated people. Does that mean that they were not in quarantine when they were COVID-19 positive? And what are the contacts? Has the contact tracing been done with them?
Yeah.
And secondly, the ministry has said that the sequencing to determine the Delta variant takes about 2 to 3 weeks. So does that mean that in some cases persons would not know that they have a Delta variant when they are positive? Thank you very much.
Okay, thanks, Brian. So just in terms of the way the process goes, so you have a positive test. Generally speaking, if you belong to one of the high-risk categories that we want to sequence, for example, persons that would have traveled within the last 14 days coming into the country, what happens is that if we have a positive test for those persons, they are treated as suspected for a variant of concern until we are able to confirm it. So those persons would be isolated. All their contacts will be quarantined for the necessary period of time. So we treat it almost like a suspect case of a variant of concern until the sampling comes back and proves us otherwise. Hopefully by that time we are able to begin our discharge criteria, which is an enhanced discharge criteria using 2 negative tests. And just to go into a little more details in terms of what you asked. So there was 2 persons who would have been vaccinated. One of them came in through the oil and gas stream, which is a little different. So they have some additional quarantine when you come into the country. Some of them work offshore, so they would have been doing some routine testing and picked up that particular case. Person had no symptoms at the time. So that case was picked up in that regard and of course referred to us for sequencing because of the recent travel. Tested, we got the results a few weeks later. We would have been able to quarantine all the contacts of that individual. Although they would have been in quarantine, they would have still have contacts within that site. So it's about 7 or 8 persons. Those persons would have been quarantined, all tested negative and discharged. The other case would have been a person who returned 5 days later, developed mild symptoms, presented for testing, turned out positive. Again, treated as if it was a suspected case. And all the isolation was done, quarantine was done. There was about 3 or 4 contacts, all of whom were in the close family of that particular person without giving too much information. And again, they were followed for the full time. We confirmed Delta, and we're in the process of going through the 2 negatives for the discharge. So that's how the sequence of events occurs in terms of treating those cases with fully vaccinated individuals. As you know, they still have to have PCR prior to entry into the country, so they would have been negative before coming into the country. Just to give you some statistics. So far, since the borders have reopened, 17th of July to present, we had 14,222 persons that would have been fully vaccinated and returned to the country. Out of those, we would have had 2 positive that we know of, giving you a chance of 0.014% of actually being positive in that cohort. Is an extremely low percentage of persons being positive in that group. Knowing we would have tested a lot of those persons, upwards of 5,000 people who belong to the oil and gas sector, after coming in as well. So there's some testing that is happening there. So just to give you a sense of what happened with those 2 people and what happens in general.
Thank you very much, CMO. We now go to IETV. We are ready for your 2 questions. Good morning.
Hi. Hi, good morning. Benjamin Hayes, ITV News. I have two questions. My first question, CMO, can you give us an update on the number of fully vaccinated individuals who would be hospitalized with the COVID-19 virus? And my second question would go to Mr. Thomas. Mr. Thomas, can you also give our viewers an update on the parallel healthcare system as it pertains to clinics and elective surgeries within the NCRHA? Thank you.
So I can give you an idea of who is in ICU, HDU, and if we had any deaths related to, and we have 99.4% of all the deaths that occurred since May to present that would have occurred during that period were unvaccinated. Again, keeping in alignment with what we're seeing across the world, upwards of 99% of those persons, again, we would have seen in the ICU at this point in time are unvaccinated, and a similar trend with the HDU in the region of 95 to 96% of those and above are unvaccinated. I don't have the ward level data at me right now, but we can that changes all the time as people are admitted and discharged, but we can get a snapshot of it in the near future and get that data across to you all as well.
Thank you. CEO, to take the second question.
With regard to the clinics, we so for example, I mentioned earlier that we would have engaged a number of patients, 30,000 plus so far, with our telemedicine trust. This is actually an engagement with a physician, and in most instances a specialist physician. That allows us though to engage those patients in a manner that is meaningful, and to the extent where we can then, particularly for those chronic disease patients, cardiac, hypertension, diabetes, once we engage also to ensure that you receive your pharmaceutical or your drug, your prescription drug. It's facilitated us now to be able, what we've seen is that there is an increase in compliance with the drugs that those patients receive, actually utilize, which is something that was unexpected but phenomenal. So it means that more persons via their telemedicine interface, because they don't have to come into the hospital for those visits, they are actually engaging with those doctors on the phones. They're also engaging to pick up their. Initially, they would have had to come into the hospital to receive their pharmaceuticals or their drugs. We place those drugs at health centers that are convenient and close to them, and pre-package them, and they pick up those drugs here. So we've seen an increase in the compliance. We've also included another tier of intervention beyond the telemedicine intervention, which is what we call our telepharmacy intervention, which means now that a pharmacist calls those patients as well to bolster our compliance levels. It means that we will in the future have healthier persons in the medium and long term, and again as a means to ensuring that we don't have that return of those patients in the distant future, an avalanche of those patients. It's proven in terms of compliance specifically to be a superior model, and we're utilizing it. The elective surgeries, officially we are doing the emergency surgeries and the very urgent surgeries until the capacity for we have the capacity available for us based on the COVID-19 scenario. So we're watching and waiting, doing the emergency and the urgent persons to ensure that persons don't suffer unreasonably because of COVID-19.
Thank you very much. See you. We now go to 103.1 FM for your two questions. Good morning.
Good morning, everyone. Sarah Chandu from 103 FM. Both my questions are hopefully could be answered by the Chief Medical Officer. Yes. So first of all, You did mention, CMO, that 14,000 plus fully vaccinated persons traveling into the country, very, 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 very few have tested positive for COVID-19. But given that the health officials do advise guidelines, public health guidelines, are any considerations being given to perhaps adjusting entry criteria for Trinidad and Tobago? My second question, there are reports recently of studies to look at the possible impact of the COVID-19 vaccine on women's periods. So, with that in mind, were there reports in Trinidad and Tobago of women experiencing early, heavier, or even more painful periods, and how were these dealt with?
Okay.
Thank you.
So let me put the figure in a different way. So out of the 14,222 persons that came in fully vaccinated, we would have had a negative PCR prior to coming in, which we have learned over the course of the pandemic significantly reduces your risk, even when you come in of having COVID-19 or developing later on. We have seen a substantial decrease in the number of positives we're picking up once we had that policy introduced a few months ago. So prior to that, we would have had almost as much as 10% of people coming in via repatriation being picked up. With that in place, general unvaccinated or not, it has gone to about 1% or thereabouts. If we look at that cohort, 2 persons positive out of 14,222, it means that 99.986% of them did not develop COVID upon entry into the country, at least that we are not aware. It is an extremely small percentage of people to change the policy for. What we ask is that for persons coming in, anyone traveling, and within that 14-day period, that's the period that you're most vulnerable of course, having COVID, having contracted it abroad, and developing symptoms based on the incubation period of the virus, that we ask you to be a little more vigilant than necessary. If you have symptoms, be tested as soon as you can. Of course, be wary of contacts. Try to keep your contact group to a minimum as much as you can and protect your loved ones as best as you could. And we're asking, of course, those people who are expecting visitors, ensure that you are vaccinated as well. So having both sides vaccinated, both groups of people, decreases the likelihood of one infection going from one person to the next. And of course, if anyone were to have COVID-19 infection, that it will be very mild in those instances. In terms of your second question, I would refer that to the Director of Women's Health, and we will try to get some feedback to you in the shortest possible period of time.
Thank you very much, CMO. We now move to the Newsday. Good morning, Mr. Chantak.
Morning, Clint Chantak of Newsday newspaper. My 2 questions are to the CMO. Firstly, I wanted to know, have we increased the surveillance regarding COVID and its variants to include the MU variant at all? Seeing that we've had is growing concern about this particular variant, and also just a bit of clarification for my second question. Really, 2 persons who came in fully vaccinated with who were fully vaccinated but contracted Delta variant. Is it that they came in and they weren't tested and were allowed to go some places, and then they subsequently became ill and they got tested and were found to have the Delta variant? If we can just get a little clarity on that.
Sure. So I think I went into a little detail with the cases. I don't want to divulge too much information, but generally the national policy for everyone is that if you are fully vaccinated with a WHO approved vaccine, you have your negative PCR, you come into the country, there's no further quarantine for that individual. So with one case, as I said, the person would have developed symptoms a few days later, took it upon himself to be tested. Once we got it tested, we treated him as a suspect variant of concern and sent it for sequencing, and did the necessary quarantine and isolation. For the oil and gas sector, they still have some element of quarantine with persons going, for example, on rigs, and the other person would have fell into that category, so he would have been tested as part of that whole network and picked up as positive, and a sequencing would have been done thereafter. With regards to the mu variant, when we send a sample to the university lab via CAFA and TPHL, we don't specify which variant of concern we're looking at. So Professor Carrington and her team will be testing for any variant of concern or variant of interest based on their sequencing, and they respond to us with what they find. So it's not specific, and they can do testing, as far as I'm aware, for the new variants of interest and concern, including mu.
Thank you very much, CMO. We move to TTT for your two questions. Good morning.
Hi, good morning, everyone. Sunil Lala, TDT News. CMO, I'm not sure if you can speak to this, but a question coming in from our sports department. Apparently, there were travel delays for the TNT's men's team in Chile because their PCR test came in via Spanish and not English. Can you say whether this is a requirement? I'm not sure if this is a question for national security. I'm not sure if you can speak to it. And secondly, a question for the NCRHA CEO, Mr. Davlin Thomas. I know some of the tents at the Wallerfield mass drive-through sites would have, some of the tents would have toppled over on Friday. Can you say whether this affected operations in terms of vaccinations and so on?
So generally speaking, when we deal with entry requirements since the beginning of the setup of the TT Pass, I believe it has been set so that if you're providing a PCR test or evidence of a PCR test or even vaccination in another language, it also has to be in English as part of the process of the TT Pass. But I think national security can speak more broadly to it beyond that.
Yes, Mr. Thomas.
Well, as you may be aware, that incident occurred somewhere around 1 a.m. to 2 a.m. within on the morning. So it would have affected. We lost possibly about 6 to 7 tents that were fundamental to the service. The team, including Ms. Rahamat, was GM Ops and the Chief Operations Officer and a number of the other persons who are operational, ensured that given the nature, again, of the COVID-19 monster that we are facing and the urgent need for vaccinations, we were able to have that up and ready for vaccination the very next day. It required that teams were working overnight to ensure that we answer the call for the urgency for people to be vaccinated, and so therefore those vaccinations at Wallerfield, because as you know, we have a number of different types of vaccines that are being issued at that drive-through. They were available the very next day.
Thank you very much. See you. We now go to TV6 to facilitate your questions. I'm sorry.
Good morning, everyone. Urvashi from TV6. Dr. Parasram, my questions are to you. Could you tell us a little bit about the digitization of immunization record projects? Because persons from the public have been telling us they've been receiving calls from the ministry saying that they have to receive a barcode. Could you shed some light on this project, and what would be the limitations on the use of the barcode or QR code, as they call it? Secondly, Dr. Parasram, some parents do want their children to be vaccinated, but they're a little bit skeptical about the Pfizer. Just a few days ago, the British government's advisory team, the Joint Committee on Vaccination, said that they don't recommend the mass vaccinations of children between 12 and 15. Can you say if talks are underway to have the Sinopharm vaccine, the inactivated virus, Sinopharm vaccine, opened up to the children age group? Thank you.
Okay, sure. So calls from the ministry have been going out with regards to digitization of the international health card. So please expect, if you are getting calls in that regard, the Ministry of Health is doing and conducting an exercise whereby calls are being made to verify the information on the cards are accurate as we move towards digitization, and we lead towards our sister ministry with regards to digitization to assist us in that regard. Your second question, Sinopharm, you're asking about other vaccines for that particular age group. Yes, the Sinopharm vaccine is in the process of applying to WHO, as far as I am aware, for the age group 3 to 17 years of age, in addition to, of course, Pfizer and Moderna, which is also being utilized in that particular age group. So the process is ongoing. As you know, Trinidad and Tobago has been utilizing a reliance strategy on the WHO approval. So once the WHO approvals are given, we will consider at our local national tag group and make a decision thereafter.
Thank you, CMO. We now move to CL Communications. We're ready for your 2 questions.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. Just 2 minor questions. Picking up on Urvashi's question. Basically, there was this youngster who had the first dose of Pfizer who had chest pains, and he was pretty much scared to go for the second dose. What does this mean for the vaccination program for young people? Would it be stopped? And then one of the things that the parent or the relative of that kid spoke to was that the fact that there is not enough information on the Pfizer vaccine. So I was just wondering, what is the ministry doing to make sure that there is more information on this Pfizer vaccine and the side effects? And then secondly, just a quick update on the uptake of vaccines by doctors, nurses, and other frontline workers. Thank you.
Yeah, so generally speaking, I think that matter was dealt with a couple of weeks ago when Dr. Ron Henry, who is the cardiologist assigned to that particular case, had gone on to both TV6 and CNC3, I believe, and given a synopsis of what happened. It's a very mild case of pericarditis, which he found in 1 case and 1 individual so far. We have given upwards of 1,959 vaccines so far to that particular age group, which accounts for 35% of the population. We estimate those sorts of side effects to be anywhere between 2 in a million to 40 to 30 in a million in terms of a wide range that WHO has given. So we continue with our vaccination program. As is customary, when we get a new vaccine into the country, I would have presented on this media conference the full gamut of Pfizer as well, in terms of the side effect profile, including the very rare risk of course, pericarditis, myocarditis, as well as allergic type reactions. So it would have been presented. We have FAQs to that in that regard, and at all the mass vac sites, parents will be counseled as to the rare side effects and the common side effects that occur before they go ahead and have that vaccination. Anyone that, of course, would have had a severe allergic reaction or severe reaction to the first dose is generally required not to have the second dose. So that's the general rule of thumb, but that will be determined by the site in consultation with physicians. Your second question, if you could just repeat it quickly for me, please.
More info on the Pfizer.
You wanted to have more information on the Pfizer?
Just now. Hello?
Yeah,
right.
Go ahead.
So I just wanted a quick update on the uptake of vaccines by doctors, nurses, and other frontline workers.
Yeah, so Mr. Thomas said he will shed some light on the North Central experience. So, Mr. Thomas?
Yeah, at North Central, we have between 60, cumulatively between doctors and nurses, between 60 to 69% of our doctors and nurses vaccinated, particularly in those those who provide the parallel service at the COVID-19 sites, which are much higher. What we've noted is as the menu of vaccines are increasing, the numbers are increasing. So we expect that we will have higher and higher percentages as we go.
Thank you very much, CEO Davlin Thomas. We go across to Tobago. We take the 2 questions from Radio Tambourine. Good morning.
Yes. Good morning, Clayton Clark, Radio Tambourine. My first question is a follow-up to what was spoken today. The option of taking the vaccines to organizations. How widespread is that, and how is it being received? And my second question, I'm seeking an update on any links between COVID-19 and suicide. Have there been any increase or decrease in reports of suicidal thoughts and attempts with the onset of vaccination in the country? Thank you.
Okay, so nationally, in terms of I could speak to our increase, as you know, the mall initiative where we were able to go to the malls began, and we are continuing our outreach across the country through various RHAs. I don't know if Mr. Thomas wants to go into a little more detail as he's here with regards to what North Central is planning by way of outreach or has done.
I'll touch on it, Dr. Hamid. eminently qualified to expand the but what we've found is that once we go into an organization, for example, the Fernandez compound, we within the day itself we engage 60-75% of the staff, colleagues, family of workers that are on those compounds. Dr. Hamid would expand.
Sure, Dr. Hamid.
Hi, good morning again. So basically what our experience so far has been with the organizations, especially if an organization reaches out to us and we engage, that uptake that we have has been pretty tremendous in terms of on the ground, because you would have then a live view of managers, different people on the ground having the vaccine taken, and then the workers and so following suit. So it is what you call a snowballing effect. When you go into any area, organization, we go to the community centers and so on, villages, remote villages and so on, you will have that peer pressure snowballing effect where people are encouraged by their own co-workers, by their peers and so on, to get vaccinated, and it is very successful in terms of also the convenience itself. You coming on the site, giving the vaccines at the absolute convenience of the employees and of the organization has been very well received, and I believe this is the way to go at this point in time, not on a national level.
Thank you very much.
Okay, and I just want to repeat your question just to make sure I have it right. So I think you're asking if we have noted an increased rate of suicide in persons that would have had the vaccine. That's the question you're asking?
Yes. Any links between COVID-19 and suicide?
The vaccine itself has not known to cause any sort of depressive thoughts or have that kind of effect as far as I am aware. And we haven't noted any phenomenon like that in Trinidad and Tobago so far.
Thank you very much. We now go to CNC3 for your 2 questions. Good morning. Guardian Media, good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so both my questions this morning are for the CMO. So CMO, I just want to follow up on some of the discussion we've been having about the borders and the fully vaccinated people coming in with Delta. Firstly, if we're being told and it's being recommended that people sort of isolate when they come in, could you explain why it is that it's only just a recommendation at this point in time and why we didn't decide to go the route of implementing it as part of the policy? And my second question is, on these 3 or 4 contacts that would have been identified with the second case, are these solely primary contacts or is this the extent of all primary, secondary, tertiary contacts? And have we seen any indication of onward transmission within these contacts? Thank you.
Yeah, so let me answer your second question first. So the other one of the persons, as I said, was linked to oil and gas, and in that scenario there was a finite group of people. They were all primary, they were all quarantined, they were all tested and all negative. In the other scenario, they had that person coming in, going home, and doing exactly what we are asking people to do. Have that level of personal responsibility, quarantining yourself to some extent, making sure you minimize your contact. And of course, as soon as he got symptoms, he would have tested, which is really what we want. It's a sort of best case scenario that we want people to do, and we're really relying on everyone to play their part and do the responsible thing. Of course, if you get symptoms, you present as soon as you can, we test, and then you isolate thereafter. When you generate policies, you have to look at what is the likelihood of something happening, and the impact of those policies generally on infringement of movement and the movement of people. We have, the Honorable Prime Minister would have taken a decision to open the borders on July 17th. And what evidence in terms of support we can do when we make a quarantine policy. So as we have suggested, when we looked at the data coming back to us by way of PCR, when we moved to a 72-hour prior entry, we saw a significant reduction then across the board in terms of the number of people coming back positive. So your policy has to be built on the back of evidence, and evidentiary support suggested that 99% of those people, vaccinated and unvaccinated, would have not had COVID had they come into the country. We also have to look at things like the extent of spread of COVID within the sub-region, within the country. So in Trinidad, as you know, we have community spread. We have variants of concern, P1 being the most dominant. So we have community spread at a high level, which we did not have in the early part of last year. You also have to take into consideration the extent at which the population is vaccinated and the ease at which we can be vaccinated when you build your policies. So all of those factors, including now that we have 2 out of 14,000 people being positive, builds the case to not have a punitive measure of quarantine of 14 days or otherwise for that small, extremely small subset of people, where you have 99% of people having to pay the price for an extremely small proportion of possibility of COVID. So we're asking everybody to do the responsible thing, and most importantly, the more we get vaccinated as an individual and as a country, the stronger we get in terms of a society and decrease the likelihood of spread of COVID, the original lineage, as well as any of the variants that may come into these shores.
Thank you very much, CMO. That's all the time we have for our question and answer segment. We thank the media for their engaging questions as usual, and of course the panel for their responses and the information that has been presented this morning. Additionally, please rely on reputable sources of information such as the MOH, PAHO, WHO, and CDC for accurate and up-to-date information. We ask that you please continue to protect yourself and your loved ones. And of course, if you haven't received your COVID-19 vaccination as yet, please get yours now. Don't hesitate, vaccinate. Remember, the COVID-19 vaccines are safe, effective, free, and available. No appointments necessary. Be safe and goodbye for now.
TTT News, delivering more news more often to more